Hi, Dr. Baker and class. My audience today is Daryl, Mary, Paul, and Tony. I'm here today to talk to you about why it's so important that everyone knows how to properly perform CPR. CPR can be necessary in many different emergencies such as accidents, near drowning, suffocation, poisoning, smoke inhalation, and so on. Sudden cardiac arrest is one of the leading causes of death in the United States and other countries. It's known that over 320,000 cases of cardiac arrest occur out of the hospital each year. 9 out of 10 victims die. The number of deaths that occur from cardiac arrest are equivalent to the number of people who die from Alzheimer's disease, assault with firearms, cancer, diabetes, HIV, fires, car accidents, and suicides combined. Yes, cardiac arrest is a life-threatening condition, but it can be successfully treated with early intervention like CPR. Wouldn't you want to know that you could rely on the people around you to know what to do in an emergency situation and your life was at risk? Or what about your loved ones? Wouldn't you want to know how to save a life if it came down to you? Everyone needs to know how to properly perform CPR above the age of 9 so we can change the statistics for the better. I want to give you some information on what cardiac arrest actually is. So cardiac arrest is a sudden loss of heart function in a person who may or may not have a diagnosed heart disease. It occurs instantly or shortly after symptoms appear. It occurs in people of all ages. If you are with someone and they begin showing signs like extreme fatigue, fainting, blackouts, dizziness, chest pains or short of breath, weakness, palpitations, and vomiting, they may be going into cardiac arrest. If the symptoms are instant and you believe an individual has gone into cardiac arrest, you need to check for loss of consciousness, no pulse, and no breathing. With that being said, I also want you to know that all of the cells in your body require oxygen to survive. Cardiopulmonary resuscitation, also known as CPR, is used to keep oxygenated blood flowing around the body to keep vital organs alive. Oxygen and nutrients are carried around the body in your blood, which is pumped by your heart. When an individual goes into cardiac arrest, CPR is necessary until a medical professional arrives with the proper equipment. So many people do not know how to perform CPR properly. In fact, 70% of Americans feel helpless to act during an emergency because they don't know how to perform CPR, or they haven't had the proper training in a long time. Most people who do know CPR are already in the health field. This needs to change. Did you know that 88% of cardiac arrests happen at home? CPR must be required for every individual to learn. Proper training needs to be taught to children as well. Any child from age 9 and older needs to learn CPR. At 9 years old, children begin to show signs of responsibility, and they appreciate the feeling of trust they get from others. Some may argue that CPR shouldn't be required, but a choice. They especially don't find it necessary for someone as young to 9 as to know. But think about this. What if you are home alone with your child and an emergency arises and you yourself need CPR? Wouldn't you want your child to know the steps to take? And also, what if you went to run a quick errand and you left your child home alone with his brother or sister? Accidents happen and emergencies can occur. What if CPR was required? What if no one knows what to do and you come home too late? What if you yourself don't even know what to do? By the time trained medical professional arrives, it's most likely going to be too late. Without oxygen, permanent brain damage or death can happen in less than 8 minutes. Children need to be made aware just as much as adults. There have been arguments that children wouldn't be strong enough to perform chest compressions and they couldn't retain knowledge. Studies have shown that children as young as 9 years old who learned CPR were later tested and were able to successfully and effectively perform CPR. Why would anyone want to take the risk of losing their loved one? I know I wouldn't be able to live with myself and the fact that I wasn't able to do anything about it because I didn't get something so simple as the proper training on how to perform CPR. I myself am pursuing a career in the health field, but took a class on first aid, which is where I learned CPR the first time. I took this class before I decided my career path, and I still continue to renew my certification to this day. The first time I was certified was when I was 18 years old. After giving it much thought, I wish I learned it at an earlier age. My family also talks about becoming CPR certified, and they plan to do so in the near future, especially now because there are young children in the picture. You can also make learning CPR a family activity. That way your young children aren't afraid to go. You are their guide and you need to encourage them. CPR training should also be a requirement in schools. If this is enforced, there would be no excuse for not learning. There are also many places to go to learn CPR, one being the Red Cross. There are so many options, just look around for what would be best for you. I've talked so much about the importance of learning CPR, but I would also like to tell you the proper steps to take as well. Of course, the first step would be to call 911. If someone else is around, have them call 911 so you can begin CPR sooner. If there is a defibrillator available, you may also need to use it. Before CPR, you want to check both the scene and the person. Make sure the scene is safe, and then tap the person on the shoulder and shout, "Are you okay?" to ensure the person definitely needs help. Call 911 for assistance and then send someone to get an AED if possible. Open the airway. The person should be lying on his or her back and tilt the head back slightly to lift their chin. Check for breathing. Listen carefully for no more than 10 seconds. If there is no breathing, begin CPR. The steps for CPR are to push hard and fast. Place your hands one on top of the other in the middle of the chest. Use your body weight to help administer compressions that are at least 2 inches deep and delivered at a rate of 100 compressions per minute. Deliver rescue breaths. With the person's head tilted back slightly and chin lifted, pinch the nose shut and place your mouth over the person's mouth to complete a seal. Blow into the person's mouth to make the chest rise. Deliver 2 rescue breaths and then continue compressions. Continue the CPR steps. Keep performing cycles of chest compressions and breathing until the person exhibits signs of life such as breathing, an AED becomes available, or EMS or trained medical responder arrives on scene. There is also a new technique called the hands-only method, which requires no rescue breaths. It's known to be just as effective. If CPR begins within 0 to 4 minutes after going into cardiac arrest, there is unlikely development of brain damage. 4 to 6 minutes, there is a possibility of brain damage. 6 to 10 minutes, there is a high probability of brain damage, and 10 minutes and over, there is probable brain damage. Why take the chance at having a loved one suffer with brain damage to never live their life again? Why take the chance at losing your loved one? Take the appropriate steps and learn CPR. You can be the one who saves the life. After all being said, my only wish is that every person will open their eyes to see how important it is that everyone from the age of 9 and above learn how to properly administer CPR. If you are not already certified, please leave here and look into places around you who offers CPR training. It will be one of the best decisions you will ever make. Spread the word. Encourage others to go out and do the same. Be the one who saves your loved one's life or someone else's loved one. Thank you.